if you're going to help a patient with cognitive decline, you need more than one tool in your toolbox. The other reason that genomics and TB006 make sense together is there is a gene variant, LGAL-S3, that codes for the synthesis of galectin-3, and individuals who make the most galectin-3 are better responders to TB006. But there's other ways that the genomics and TB006 relate as well. And the other ways they relate is there's other gene variants that contribute to high galectin-3 or the galectin-3 activation pathway. There's microglial pathways like TREM2, there's granulin and progranulin pathways, toll receptor pathways. And so that's one way is genomics can help you have a better discussion with your patients about whether they're going to respond to TB006 or likely to respond, but it also helps you optimize other identifiable risk factors so you get better cognitive outcomes. And that's a big one because if someone's going to invest in TB006, they want to get their brain as well as possible. So using the tools together makes sense. So let me just show you a little bit what that looks like. I talked about that LGAL-S3 SNP, and you'll see here, because it is much more common for people to be responders than non-responders, it's going to pop up, it's going to not show that they don't have this rare variant and pop up, this patient has 0 copies of the LGAL-S3 SNP, which gives them a better predicted response to TB006, an anti-galectin-3 antibody treatment based on initial research. So that gentleman that I just showed you, that's a good TB006 responder, he and his wife were hesitant because they're like, well, we want to know what's not, is this likely to help my husband? It was really the wife, because at this point, the patient has an MMSE of 12. The genomics really helped us. This is a patient I had been managing for 6 years, and we'd done quite well to keep him from getting, able to stay at home. He's an ApoE44, so super high risk. He's already in his late 70s. And he also has factor V Leiden. So he has a hypercoagulable state. He has a mitochondrial problem. So we already addressed many different factors, but now his dementia is getting worse and he's getting Parkinsonian symptoms. I was able to use his genomics saying, look, you've got the best response from the LGAL-S3 SNPs, but you also have 2 copies of this tau-related SNP, and those all contribute to how you're going to respond, or the likelihood, theoretically, of you responding to TB006. And so genomics helped him feel more comfortable with that decision. And it helped us, again, optimize him in other ways.